All right. So I will go ahead and get started. My name is Samantha. I'm a community health manager here with Prevent Blindness Wisconsin. And today we'll be going over dry eye awareness. Right. I'll start off with just a brief background on our organization in case you're not familiar. Prevent Blindness Wisconsin was founded in 1958, and a big bulk of the work that we do is centered around vision screening and then also vision health education too. Our goal is to preserve the gift of sight for Wisconsin's children and adults, so we do offer programming for the lifespan. And then a little bit more about the work that we do. We partner with a lot of different individuals throughout the state. So we partner with Wisconsin health departments, shelters, the Department of Public Instruction, including school nurses, Head Starts, childcare centers, private schools, and many others throughout the state. And we do support those partners as they vision screen throughout the year as well. And then just to show you our impact from the last fiscal year, we did reach over 989,000 Wisconsinites with our programming. We also served a little over 177,000 with our direct preventative vision health services. We conducted about 73 statewide virtual trainings, and then we did train over 1,100 individuals as certified vision screeners as well. We do serve the entire state, so all 72 counties. So you can kind of see a breakdown of that on this slide as well, kind of showing you by county. So this is going to include things like trainings, vision screenings, public health education, and then also our monthly newsletter too. So then today we'll just touch on what dry eye is. We'll go over an overview of the tear duct system. We'll talk about some symptoms that we might experience with dry eye, some risk factors for that, how we can prevent dry eye, and then we'll also end on some treatment options that are available too. So to start off, how common is dry eye? It is estimated that about 16 million people throughout the US do currently have dry eye. Women are twice as likely to develop dry eye compared to men, and we'll talk about why that is in just a little bit too. It is common in adults 50 years and older, and the majority of individuals over age 65 do experience at least some symptoms of dry eye. So, what exactly is dry eye? This occurs when the tears aren't able to provide the eye with adequate moisture, and having this lack of tears will cause some inflammation and can also cause some damage to our eye's surface as well. You'll see a picture on the slide here kind of showing some of that redness and inflammation that we might experience with dry eye. And some of the leading causes of dry eye are going to be an inadequate amount of tears and then also poor quality tears. So how exactly do tears work? These are going to help the eyes stay hydrated and help keep the eye surface smooth. It also allows our eyes to focus and see images clearly on a regular basis. They will also help protect our eyes from irritation and any infection. And these tears are going to come from glands that are located above the eyes and then drain into our tear ducts. So a little bit more on that. I do have a visual here on the slide. This is going to represent our cornea here, or kind of that outermost portion of the eye. And then we have a few layers that I'll talk through here. So first we have the lipid layer. That's going to be this outermost layer, kind of highlighted in yellow here. That is an oil-based outer layer that's going to help reduce evaporation of our natural tears that we have. The next layer I'll reference here is this middle or aqueous layer. So with this is made up mostly of water, and that's going to help lubricate the eye and then also wash away any stray particles that we might have in the eye too. And then lastly, we have the innermost layer or the mucin layer, which is located right here next to that cornea. That is the inner layer that's going to allow the watery or aqueous layer to spread across the surface of our eye and then also provide some nourishment for that cornea too. Here's another visual of that so you can kind of see what that looks like in relation to the eye. So we have that inner mucin layer here. We have that middle aqueous layer in the middle, and then we'll have that lipid layer on that outermost part right here. And then some of the structures that are going to be involved in tear production too. So we have a few different glands here. So we have the lacrimal gland located above the eye right up here. And on the next slides, we'll talk a little bit about each of these too. And then next we have the meibomian glands. So these are going to be located on the lower lid and then also along this upper lid as well. And then we also have goblet cells in the conjunctiva of the eye, or that white portion. But like I mentioned, I'll talk through each of those next. So first up, I have the lacrimal gland. This is located above that lateral end of the eye. So you can see an example of that here, kind of looking at a side view of that, and then what that looks like head on as well. So this gland is going to release fluid and then also protect the eye's surface and keep that moist for us. With those meibomian glands, like I mentioned, those are going to be located on that lower lid here and then also on the upper lid. Those produce oil that's important for our tears. If we have some dysfunction with those glands, that can lead to dry eye though. And then with the goblet cells, so again, those will be located in that white portion of the eye. Those produce and secrete mucins that hydrate the surface of the eye. It's also important for maintaining that proper mucin balance too. All right, so what are some symptoms we might experience with dry eye? You might feel like you have a stinging, burning, or scratchy feeling in the eye. Sometimes it feels like a sandy or gritty irritation, feeling like you have something in your eye that you can't get out. You may have some excess mucus in or around the eye. You might notice you have some sensitivity to light, maybe some redness and irritation. You might notice your eyes are really watery, followed by them feeling really dry afterwards. And then you may notice some blurred vision or fatigue as well. So I'll just talk through some risk factors with dry eye. The first one I have here is age. So with this, dry eyes are more common in individuals over the age of 50. As we age, our tear production by that lacrimal gland above the eye does tend to decrease a little bit. Next, I have gender. So like I mentioned before, women are more likely to experience dry eye compared to men. That can be attributed to some of the hormonal changes that women experience. So things like menopause or pregnancy. Typically, hormonal changes in estrogen, progesterone, even testosterone can affect the quantity and then also the quality of the tears that we have. Another thing with this too is eye makeup that can clog those meibomian glands that are located on that upper lid and then also that lower lid too. So that can disrupt some of our tear film and then also cause some eyelid inflammation too. The next one I have here is medications. So some of these medications can cause some decreased tear production for us. So I just have a few examples on the slide here. So I have antihistamines, decongestants, antidepressants, and then also high blood pressure medication. That's not an all-encompassing list, but just a few examples of some that we may experience that with. Next, I have medical conditions. So with Sjogren's syndrome, rheumatoid arthritis, lupus, thyroid disorders, and then also vitamin A deficiency. So with some of the autoimmune diseases that can cause the immune system to attack some of those healthy tissues or organs, that also includes our glands that do produce tears. So that can play a role in that as well. Vitamin A deficiency can also cause the eyes to dry out a little bit as well. Screen time is another risk factor. So as we spend, large amounts of time on screens, whether that's phones, laptops, tablets, things like that, we do tend to blink less frequently. So that can cause the eyes to dry out and then also cause the eyes to produce less tears that way too. And then the last risk factor I have here is refractive surgery. With this, I'm referring to LASIK surgery. This can decrease tear production and then also contribute to dry eyes as well. About 95% of people who go through LASIK surgery do report having dry eyes. So after having that surgery, they do report that a little bit more. All right. And then going into some ways that we can diagnose dry eye. These are all things your eye doctor may do with you. But I just wanted to touch on each of these briefly. The first is a comprehensive eye exam. So with this, your eye doctor may take a closer look at the eye, look at the overall health of your eye, and may do a screening for some common eye diseases that we see, in addition to looking to see if you do need glasses as well. The next one I have listed on here is the Schirmer tear test. So with this, this will help determine whether your eye produces enough tears to keep it moist for you. So with this test, the doctor will place a strip of filter paper inside your lower eyelid. And then after a couple minutes, they will remove that and they can measure how much of that strip of paper has become moist. Similar to that one, they can also try the phenol red thread test. So with this one, they will use a piece of thread that is filled with some pH sensitive dye. They will put that over that lower eyelid. And then after a certain amount of time, they can measure your tear volume with that. So those two are pretty similar in that respect. The next option that your eye doctor might try with you is using special dyes and eye drops to determine the quality of your tears too. So they can use those dyes and eye drops to kind of look at the surface condition of your eye. They can look for some staining patterns along your cornea, and then also measure how long it takes your tears to evaporate too. Another option they might use too is the tear osmolarity test. So this will measure the composition and particles, and also the water in your tears. So as you would expect with dry eye, there should be significantly less water in your eyes there. And then the last one they might try to is they can look at tear samples to look for markers for dry eye. So for example, lactoferrin is something that's produced in your tears regularly. So they may look at that to see if you have decreased levels of lactoferrin. If so, that may indicate that you are experiencing dry eye. So there are a few markers that they might look for to indicate that as well. All right, next I'll just touch on a few techniques we can use to prevent dry eye, some things that we can think about. So the first is just blinking regularly when you're reading or maybe using a computer for a long period of time. Like I mentioned before, when we're, spending lots of time on screens, we tend to blink less frequently. So that's something that we can think about. Another is it just increasing the humidity in the air, whether that's at home or at work. We can use a humidifier to keep some of that moisture in the air. We also recommend wearing sunglasses outdoors. Another thing is just staying hydrating. So staying hydrated. So we're drinking, 8 to 10 glasses of water a day. Can also try to avoid air blowing into your eyes, whether that's from air conditioning or air from a fan. And then also just avoiding tobacco smoke too, along with that secondhand smoke. With that, tobacco can affect the eyes a little bit too. It can restrict some of our blood vessels and then also reduce some blood flow too. And then I'm just going to finish up with some treatments that are available for dry eye. So I'll touch on a few different things here, depending on what that root cause is. But the first slide I have here is just treating eyelid or that eye surface inflammation. So with that, we could use a prescription eye drop or ointment. We can also use a warm compress in lid massage. I have that, a warm compress kind of shown here to show you what that would look like. And then we can also use eyelid cleaners too. So for all the ones I'll mention too, always best to just check with your eye doctor and see what their recommendation is for you. Really just depends on your case too, but they can always recommend the best course of action for you. The next one I have is increasing tear production. So with this, we can use an eye drop to increase those tears. Omega-3 fatty acids or a fish oil supplement has also been shown to help with this. But again, like I mentioned, your eye doctor can kind of push you in the right direction too and see if that is something that would be helpful for you. The next one I have is for conserving tears. There is a procedure they can do called a punctal plug procedure. With this, they will take a silicone or a gel-like plug. You can see those pictured on the slide here too, those small little plugs, to block those tear ducts so that you can conserve some of those tears too. Another option we have is adding tears, so we can use an artificial tears eye drop to help with that too. All right, and then I just have a kind of final note on dilated eye exams, just like to mention this. So just like to point out the difference between an undilated pupil and then a dilated pupil. So you'll notice with the picture on the slide here with that dilated pupil, we get a much larger image of the back of the eye with that. We can see the retina along the back of the eye and then also that optic nerve. That optic nerve is going to be that main communication system between our eyes and the brain. So it's just important that the eye doctor can get a really nice look at the back of the eye to make sure everything looks healthy. You'll notice with the undilated pupil over here, it's a much smaller portion of the back of the eye that we can see. People also might ask, how often should I get a dilated eye exam? So we just have some recommendations on that here. So adults 18 to 59 years old with no risk factors or vision concerns should get a dilated eye exam about every 2 to 4 years. Adults who are at risk for or who have been diagnosed with a vision concern, so anything like glaucoma, diabetes-related retinopathy, age-related macular degeneration, anything like that, should get a dilated eye exam once per year or as otherwise recommended by their eye doctor too. And then adults 60 years and older should get a dilated eye exam once per year as well. As we age, our eyes just tend to change a little bit more frequently. And if you do notice any vision concerns or changes in your vision, always great to get a dilated eye exam as well. All right, that's all the content I had for today. If anybody has any questions, I can try to answer those. Otherwise, you can always reach out if you think of any questions as well. Right. If nobody has any questions, I can let you go. Thank you all for joining today. I hope you have a good rest of your day.
Thank you.
Thank you.